And the United Nations International Children's Emergency Fund says it is concerned about the alarming rate of child mortality in the Northeast. Speaking in Jos, the health officer of UNICEF Bauchi Field Office said approximately 120,000 children under the age of 5 are dying each year, with many of those deaths being preventable. Senior reporter Olabi Adenusi compiled this report.
Northeast Nigeria is the second in the country with high rate of child mortality. The alarming rate is fast becoming a concern to UNICEF, which gave birth to this media dialogue for practicing journalists in Taraba, Bauchi, Gombe states. The interaction focuses on raising awareness of the root cause of child mortality, its socio-economic and health impact, and the urgent need for collective action from a broad range of stakeholders.
We're actually here to create more awareness on child mortality. In the last 10 years, there has been a lot of some investment. However, the progress has not been very significant. UNICEF has been supporting some states in terms of working with government, partnership with government around maternal and child health.
The health officer UNICEF Bauchi Field Office speaks on solutions on how the challenges can be summoned.
There are 17 goals. Some of the determinants of the survival of the child, the health of the child, is beyond health. It has to do things even with climate change, even with poverty, even with education. Rural-urban disparity comes in. Access to water.
Some health workers in Taraba and Bauchi who took part in the program share their views with TVC News.
If I go back to Taraba State, I will make sure to collaborate with the partners and the policy makers to make sure that we reduce the root cause of infant mortality rate in my state.
So the take home for this meeting, actually it has enlightened a lot for me, having seen our indices for Bauchi State. For example, the number of children that died between 2023 to date, of which that at least that will ginger the government to bring more intervention that will address such issues.
Governor Abu Kefas of Taraba State recently increased the health budgetary allocation for 2024 from 7.8 to 10.5%. The expectation of the stakeholders in the health sector is to see Taraba State government meeting up with its 15% Abuja declaration for health budget in the 2025 budget.